So what exactly is a pap smear? Pap smear, pap smear. People keep talking, people keep asking, and others know, others don't. And those that know still don't want to do it. It's something that a lot of women are shying away from and really running away from. And today I am here to debunk the myths about doing a pap smear. What exactly is a pap smear? Welcome to Not That Conversation with me, Dr.Q, Cele. And here we're talking pap smears today. So, who exactly needs a pap smear? Now, if any woman has ever had sexual intercourse, I'm talking to you. You need a pap smear. So every woman who has ever been sexually active, whether you are now celibate and you're no longer having any sexual intercourse, if you've ever had sexual intercourse and have never done a pap smear, it is very important to have your pap smear done. So who am I talking to? Raise your hand, raise your hand. I see you, yes. Pap smear for you, pap smear for you, pap smear for you, pap smear for everybody. That's what we're talking. As long as you've had sex, please have your pap smear done, because pap smear is related to a screening procedure. It's actually not even a procedure. It's a small process that we do during screening for sexually transmitted infections that cause abnormalities in the mouth of your womb. Now, this sexually transmitted infection is called HPV, human papillomavirus. Human papillomavirus is transmitted sexually, and it causes more than 99% of cervical cancer. So that's where we don't want to go. Now, if you've never had a pap smear, but you've been sexually active, there is a possibility that HPV may be there. Now, what HPV does, it absolutely loves the cells of your cervix. It gets there and clings to them and makes sure that they live and live and live for long instead of dying the natural cell death, which we call apoptosis. So they keep growing and they keep growing when the HPV is there, and that is what leads to cancer. Now, the sad part is you don't know. You don't know what's happening down there. So somebody's got to check you out. Somebody's got to check what's happening down there. And it's not something that you can straight away see with the naked eye. It needs to go under the microscope. Your cells need to be tested under the microscope to see if they have started differentiating, or they're still normal, or what's going on. So you do need to get somebody. So yes, that's the reason why you need your pap smear to be done. Now, how is it done? What do I need? First of all, this is called a speculum. A speculum is an instrument that is used to go into the vagina and open it up, stretch it out, so that we can be able to see into the cervix, which is the mouth of the womb. Okay, so it goes in vaginally. Then I need my specimen bottle, and then we just take a specimen, a sample, and you see there is no knife, there is no blade. It's just a simple brush that we use to actually, as my patients would know, I say a small stretch and a tickle. So we just tickle the mouth of the womb with this, and it's nothing painful. So, and of course I need you for the pap smear, otherwise I can't be doing anything. So this is my sample. I don't have a real life patient. No, I'm not going to give you that opportunity. So this is resembling the labia minor, the lips on the inside, and then this will represent the vaginal opening. Okay, which stretches, if this thing can take out a 10 centimeter head, guys, I'm sure it can take this thing out, but don't give it a break. So for those that are scared, this is what actually happens. This goes in vaginally, and then we start stretching it out for us to be able to see, for us to do the pap smear. And then this goes in the vagina, and then I'm able to go in visibly. I need a nice good light source for me to see the mouth of your womb, and we go in, and as I always say, you feel a stretch and a tickle, and that's all it takes, and the pap smear is done. Now this is the sample that we take just for more visibility. This is how it actually looks. So we go in through the vagina. This is the cervix, which is the mouth of the womb, and that's where HPV likes to grow. So we go in and a small tickle, and we come out, and that's it. We've got your sample. It takes a few seconds, and this is a sample then that we take to the laboratory to be assessed for any abnormal cells and the presence of HPV. The recommendation is that you can do a combo. For screening, do both to check whether the abnormal cells are there and if the HPV is there. So check yourselves out, get to know what's going on, and remember, HPV can be vaccinated for. It starts at the ages of 9 for young girls and young boys, and all the way to the age of 45 for women and 26 for guys. And unfortunately, there is no screening test for men, as much as they are the carriers of HPV. But hey girls, get yourself checked out. Get yourself to know whether there is HPV or not and what's going on inside there. So if you've had fun the night before, don't be canceling your appointments now. We can wipe everything out and then get the proper job done. That's the truth. So as long as you are active, please get your pap smear done.